Okay guys, so now in this second lecture I will just continue this history taking format. So in the initial I just talk about demography, that you can ask the patient from age, because some diseases are common in the young age and some diseases common in the old age. So this is the basic format, that why you talk about the age, sex, because some diseases common in the married life and some disease common if you are not married. So this is the thing, that in the age it's also depend on age. So then I talk about the past medical or past surgical history. So you can ask about, is their patient suffer any previous disease like hypertension, like diabetes. You can ask about any previous surgery, any patient has did any previous surgery, any obs or gynecological surgery like any C-section in the previous, any psychiatric history like patient suffer with any anxiety, depression or panic disorders. So this is a thing you can ask in the past medical or surgical history. Past medical history can be diabetes, hypertension, osteoarthritis, any disease that patient go through from the past, and this is the past medical or surgical history. Then we will talk about the family history. In the family history we ask that in your family anyone suffer with any disease like osteoarthritis, like diabetes, like hypertension. Yes, in the past medical history you can also ask about any previous CV attack, any cerebrovascular attack, any heart attack. So this is also very important in past medical and surgical history. In the family history you can ask about that in your family anyone suffer with any disease. It can give you clue, because some diseases are run through genetically, like SLE, rheumatoid arthritis. These some are genetically, like anxiety, they can run from one person to another person, maybe in the family. Allergic history you can ask in the past medical. Why? Because if for example mother is suffer with allergy or asthma, maybe her daughter or son suffer with also asthma. So this is a familial or allergy history you can ask about in the past medical. Okay, so this is a thing very important you should know. Then family history you can ask about, in your family anyone suffer with any disease, anyone suffer with heart problem, or anyone suffer with severe attack, or osteoarthritis, rheumatoid arthritis, or TB, tuberculosis. This is very important. You can also ask tuberculosis in the past medical history as well. Then you can talk about the patient medication, because every hospital setup format is little bit different but sequence is same. So you can go in any hospital, you can find the same thing but pattern is different. Okay, so I'm just talk about generally. So then the medication you can ask about, you are using any medicine or not, any allergic medicine, any hypertensive medicine, any diabetic medicine. So patient will give you that I'm using from long time from insulin, like I'm using any and oral hypoglycemic drug. This is the thing you should know. Then you can ask about the personal history. In the personal history ask about, how about your sleep, how about your diet, how about your urine frequency, you taking any sleeping pills or not, and how about your appetite. So this is the thing you ask about in the personal history, or you can say that social history. You can go little bit deeply in the social history. There you can ask about your smoker is male patient, ask about smoking, ask about any drug addiction. So this is the thing. Then after that we will review of systems. We will start general physical examination. We start from CVS, cardiovascular system. We start from then CNS, then respiratory, then GIT. So this is a thing we will ask about in the history taking. This is the way how you will take the how you take the history when you become a house officer, or when you in the third year, fourth year MBBS, or when you in the as a MO. So in whole profession history will go with through all the things. Okay, so I hope guys you understand. Thank you so much.